My name is Kendra Johnson. I'm the Executive Director of Equality and C. I use she and her pronouns. And for those of you who cover us and who use us as sources, you already know that we're the oldest statewide equality organization in the nation. We turned 40 last year. We're now turning 41 in a few months. And we really wanted to hold this press training because a huge part of what we do is actually telling the stories of LGBTQ people in their own terms and with the appropriate language, so that we can not only get out accurate information, but also change hearts and minds about the plight of the LGBTQ community. So this is a safe space for questions, so that you get the key terms, you understand some of the issues that are currently pending in the United States for the LGBTQ community and globally for that matter. We want to particularly lift up the Supreme Court cases that are currently pending. We're awaiting a final decision from the Supreme Court on 3 cases around sexual orientation and gender identity, and whether they can be, whether we can legally be discriminated against in the workplace, or whether these issues can be interpreted as part of existing protections in the workplace for our community. So I just want to offer that this is a learning space. We're going to walk through some of the current landscape for the LGBTQ community, some key terms, and create a space where you can ask us any questions and use us as a resource as you're continuing your coverage of current affairs and the LGBTQ community. So there are no stupid questions. Of course, there are stupid questions, but we're going to treat them as if they were not stupid, because this is a safe space for you to get the information so you can provide the most accurate coverage about our community and continue on a learning journey with us going forward. So we thank you all for being here. I want to, before we jump in, just give everyone on the call an opportunity to introduce themselves and their role at Equality and C pronouns, and hope that you'll continue to use us as a resource as you chronicle our lives through the digital pages and the physical pages of the news outlets that you represent. So I'm going to start out with just tossing it to James Michael Nichols and let him introduce himself.
Hey y'all, James Michael Nichols, he, him pronouns. I'm the Director of Communications at Equality North Carolina, and we're happy to have you here. Toss it to Artie.
Hi everyone, I am Artie Hartzell. I am the Advocacy and Elections Strategist at Equality North Carolina. Thank you so much for joining us. I will be kind of making sure everything's running smoothly. I was just typing in the chat box, but I'll also say here that if you're uncomfortable asking a question out loud, because we are recording and going to be sharing with colleagues, feel free to chat it in the chat box. It won't show up on the recording. So we'll see it, but we won't have, if you don't want your name attached, we can just answer the question. And I will toss it to Ames, and we'll get started.
Hey y'all, good afternoon. Good to see you on our call. I'm Ames Simmons. My pronouns are he and him. I'm Policy Director at Equality North Carolina. I identify as a queer, white, transgender guy, and that both the limitations that come along with that as well as the lived experience are both relevant to some of the things we'll be talking about today. Kendra, did you want Adrian to introduce her? Okay, so I will kick it to Adrian.
Thank you, Ames. Hi, I'm Adrian Spinner. My pronouns are she, her, and hers, and I'm the Triad Civic Engagement Coordinator.
Okay, so I think it is coming back to me. I am about to share out my screen because there's a lot of data on these slides that it's probably better for you to see. I included some endnotes in here, so if you want to have links to the original source material, you will have that. I think we are taking questions as we go, but just know, since I'm sharing my screen, I don't know whether I'll be able to see the chat box, so somebody please feel free to interrupt me as needed. Okay.
Got you.
Let's hope this works. Alrighty. Too fast. All right, so we're gonna start just with some level setting here at the beginning. We have a longer LGBTQ kind of cultural humility training that we're not gonna go through all the ins and outs of that right now. But again, feel free, if we're using terms that aren't familiar, definitely let us know so we can explain those. One of the issues that we come across a lot is folks understanding the difference between sexual orientation and gender identity and expression. And it's understandable why that might happen because of the evolution of the term LGBTQ. That stands for lesbian, gay, bisexual, transgender, and queer. And so you have a gender identity that is in the middle of an acronym that otherwise applies to people's sexual orientation. But they are distinct concepts, although they are related to one another. And it's important that we don't talk about transgender people versus LGBTQ people, because trans and non-binary folks can be heterosexual, or they can also be lesbian, gay, bisexual, or queer. So when we're talking about sexual orientation, this is a person's emotional or physical or romantic attraction to another person. So it is relational. It talks about how you relate to someone else. Gender identity, on the other hand, is a person's deeply held internal sense of being male or female or somewhere else on or outside the gender spectrum altogether. Sort of are thinking this as a gender universe or galaxy these days. Transgender, non-binary, gender non-conforming are examples of gender identity. Gender expression refers to all of a person's external characteristics and behaviors like clothing, grooming, mannerisms, speech patterns, and social interactions that represent or express one's gender identity to others. So everyone has a sexual orientation, everyone has a gender identity, and everyone has a gender expression. And there are no, well, there shouldn't be. At Equality NC, we don't try to police folks' gender expression. Like people can choose to identify how it's authentic to them. There are not rules about what qualifies a person to be LGBTQ. Okay, like that is the intro. So I am going to, if there are no questions, I'm going to talk a little bit with these data to help set the context that we are currently in when we're talking about these potential decisions that could come down any day now about related to workplace protections. So as you all have been covered in the media, we are in the middle of a pandemic like we have never seen before. And it is important to lift up that members of the LGBTQ community also hold identities that may make us either more vulnerable to COVID-19 or make the effects of COVID-19 worse for members of the LGBTQ population. Of course, this slide has statistics about LGBTQ people. Definitely, we have seen documented in the press that there are disparities along racial lines in the way that COVID-19 is affecting people, and for members of the LGBTQ community who are also people of color, then they will have an exponentially greater impact. So just bear in mind intersectionality. There are older folks who are part of the LGBTQ community, over almost 2 million people who are older than 50, which is the age that SAGE begins tracking. Of course, there's construction across the street, sorry. SAGE is Advocacy and Services for LGBTQ Elders. And we estimate that there are over 200,000 trans people who are 65 and over. Those are two different studies, so that's why there's two different age metrics. LGBTQ people, importantly, are also more likely to have respiratory health disparities. Part of the reason for that is because LGBTQ people are more likely to smoke compared to cisgender or non-trans and heterosexual people. So you can see that comparison is 37% compared to 22% of people who are cisgender and straight or heterosexual, almost 300,000 trans people. So among other things, it's been measured that folks in the LGBTQ community are more likely to have asthma. So LGBTQ people, approximately 21% compared to only 14% of cisgender and heterosexual people. And over 200,000 trans people have asthma. I am one of those people. I have to have my inhaler around at all times, and many folks in the queer and trans community who also have asthma have reported the same that I have, that just the stress of COVID is exacerbating asthma, even without regard to COVID-19 being thought of as primarily a respiratory condition. There are also higher rates of other chronic health conditions that can make COVID-19 more difficult. Almost 1.5 million LGBTQ people are living with diabetes, almost 100,000 transgender people, and it's been well documented that people in the LGBTQ community are more likely to be living with HIV, particularly at intersections. So 1 in 2 Black cisgender men and transgender women, 1 in 4 Latinx cisgender men and transgender women, and 75,000 trans people are thought to be living with HIV. The data collection for gender identity is not where we need it to be, so there's probably greater numbers than what's reported here. Also important to note that HIV in and of itself is not a risk factor for COVID-19. It has to do with the immunosuppression of a person's system. So if a person is virally suppressed, meaning that they are in treatment to the point that the viral load of HIV in their blood is not detectable, then they probably have the same risk that folks who are not living with HIV have. But not everybody is able to be in treatment, and even those who are may not be able to be virally suppressed. In addition to health disparities, there are also issues of access within the LGBTQ community. So 17% of LGBTQ adults are uninsured, which includes 22% of trans adults compared to only 12% of non-LGBTQ adults. There's some data here about the impact of Medicaid expansion, which we are not experiencing here in North Carolina, that I can provide to you if you're interested. Additionally, 23% of LGBTQ adults of color are not insured, and 32% of trans adults of color are uninsured. The US Trans Survey that was fielded in 2015 found that 450,000 trans adults have not gone to the doctor in the past year because they couldn't afford to. We know that those statistics are higher now because if we are not in a recession, we're imminently entering one. Many people are unemployed. LGBTQ people also are less likely to have access to leave policies that help us to cope with COVID-19. So only 29% of LGBTQ people have access to paid sick leave, and only 20% have access to paid family medical leave if one of their family members should contract the virus. We started talking a little bit about employment. There have been a couple of good studies from the Human Rights Campaign and from Williams Institute that have put together some data points here. So more than 5 million LGBTQ people work in industries that are likely being very hard hit by the coronavirus and by the stay-at-home orders that have been put into effect to mitigate it. So many LGBTQ people work in food, hospitality, and personal services. And in fact, one of the top employers of LGBTQ people is the restaurant business. So almost 15% of LGBTQ workers are in the restaurant business, which, as we know, continues to be a difficult environment to reopen, even looking at Cooper's most recent executive order issued yesterday. LGBTQ people have also been more likely than the general population to have experienced a cut in work hours, so 30% compared to 22% of cisgender and heterosexual people. And nearly 1 in 10 LGBTQ people are unemployed, and 1 in 5 live in poverty. The unemployment rate that we know of prior to the pandemic was that trans people are 3 times as likely to be unemployed. The U.S. Trans Survey North Carolina report finds that the North Carolina respondents were right in line with that statistic, reporting 3 times the level of unemployment. This is an important point that I haven't been really pausing to let it sink in. COVID-19 may hit LGBTQ people and all marginalized people hard because of a history of discrimination in our country. This is not an issue of personal responsibility of why the virus is hitting our community. It's because it is exposing inequalities that have been there all along. So for one thing, LGBTQ people are less likely to have access to employment-based health insurance. Because many people get their health insurance from their employer, LGBTQ people may lose the insurance that they have if they're fired because of gender identity or sexual orientation. And in fact, LGBTQ people may never have been hired in the first place because of employment discrimination. Also, LGB people are less than half as likely to have insurance through their spouse's employer. And that's an important point because even after marriage equality, since we don't have non-discrimination protections that are uniform across the country, it means that some LGBT people who are married may not feel safe about outing themselves by adding a same-sex partner to their insurance policy at work. In addition to the economic impacts of COVID, we also need to worry about the impact of discrimination in healthcare. So 1 in 4 LGBTQ people have reported experiencing healthcare discrimination, and almost 1/3 of trans adults reported that a healthcare provider refused to see them. I have had that experience myself, although it has not been here in North Carolina. What's probably making this worse is that the Federal Department of Health and Human Services is in the process of finalizing a rule that would remove the explicit protections that are there for LGBTQ patients under Section 1557 of the Affordable Care Act. The signals are that they could issue that final rule at any time. HHS has also stopped enforcing non-discrimination for service providers that receive federal funding from HHS, an incredibly broad rule that's being challenged in court. And HHS has proposed to eliminate safeguards for LGBTQ people seeking services from faith-based providers. You can already see the importance of that with Franklin Graham providing healthcare services in Central Park through Samaritan's Purse in New York as part of the virus response. I will say briefly, when we're thinking about why this Supreme Court decision is important, The whole framework of federal non-discrimination laws, you may know, is built on the Civil Rights Act of 1964, which really created this paradigm of equality and prohibits discrimination based on race, color, religion, sex, or national origin. And Title VII of the Civil Rights Act of 1964 covers employment discrimination. That is the component of the law that the Supreme Court is considering now. Not for nothing, I will say that originally discrimination in public accommodations was only covers race, color, religion, and national origin. The framers of that law were really thinking about the importance of desegregating public spaces and did not include sex. And as you'll see in a minute, that is a big hole that we need to fill. And so there's a lack of federal protection there. You notice I did not say sexual orientation or gender identity under Title VII or the Civil Rights Act, even though many people think that LGBTQ people are covered under that act. They believe that erroneously. It's also important to look at what state laws say about non-discrimination, particularly because employment is very much a creature of state law. Soon, 22 states will have laws that explicitly prohibit discrimination based on sexual orientation and gender identity. I have Virginia listed there because they have passed and signed a groundbreaking statute into law. It was the first in the South to explicitly prohibit this kind of discrimination, but it does not go into effect until July. 25 states, including ours, have no statewide protection from discrimination based on sexual orientation or gender identity at all. North Carolina does protect some employees who work for state agencies and departments under Executive Order 24, which Governor Cooper issued in October of 2017. One of the vagaries of executive orders is that they are prone to be pulled back if there's a change in leadership in the governor's office. So we need to have more permanent protections. So of course, 22 and 25 doesn't add up to 50. So there are 3 other states who are somewhere in between all or nothing in terms of their protection. It is not for a lack of trying that we don't have statewide protections. I think every legislative session since at least 2015, the Equality for All Act has been introduced, which is a comprehensive civil rights bill that covers lots of different contexts, including employment, but also including housing and education, public accommodations, and even jury service. And it was introduced into the General Assembly during 2019's long session, but did not survive crossover day. So it did not pass one chamber, which means that it is not viable until it will have to be reintroduced in the 2021 long session. Looking forward to federal protections, as Kendra mentioned, the Supreme Court is deciding these Title VII challenges. They heard oral argument in October of 2019 and could issue a ruling literally any day. Tomorrow may be the day, we don't know. These 3 cases were consolidated challenges to the application of Title VII protection against discrimination in employment based on sexual orientation and gender identity. There were 2 sexual orientation-based cases and 1 gender identity-based case. So one way or the other, the court's decision will either take away the existing LGBTQ employment protections that courts have affirmed under Title VII, or it will affirm that existing law does protect LGBTQ workers. Regardless of the outcome from the Supreme Court, it is important for us to pass federal protections that explicitly include sexual orientation and gender identity. Since 2015, when the Equality Act was first introduced into the US House by Representative David Cicilline, in each subsequent Congress, the Equality Act has been introduced and actually passed the House almost right at a year ago as H.R. 5 and is not expected to go anywhere in the US Senate. The entire North Carolina Democratic delegation co-sponsored the Equality Act, and it's broader than a law that was originally in Congress, the Employment Non-Discrimination Act, because it prohibits discrimination based on sex in addition to sexual orientation and gender identity in a variety of contexts. So in addition to employment, it covers housing, education, federal funding, credit, jury service, and public accommodation. So it's plugging that hole in the Civil Rights Act that doesn't currently cover sex at all. It also broadens the definition of what are public accommodations so that it additionally includes recreation, travel, exercise. These are several noticeable gaps that weren't included in the Civil Rights Act. And importantly, for members of the trans and gender non-conforming community, it prohibits denial of access to a shared facility in accordance with gender identity. And presumably, if that were to pass, it would preempt any action that the NCGA has taken to restrict access to facilities thus far. And that is what I have. I have these endnotes that I will make available to you.
Thank you so much, Ames. At the end of all of this, I have a one-pager outlining potential outcomes of the case that I'm going to send around to anyone who registered for the webinar. And I'll include Ames's endnotes and resources in that as well. I'm going to briefly share my screen for my portion of this conversation. Everyone see that? So I'm going to walk through a couple of the potential outcomes surrounding the 3 cases before the United States Supreme Court. This is all from a tip sheet that GLAAD made for journalists who are working with or surrounding these 3 cases. So consolidated it together for y'all, and I'll be sending it out after the conversation. So how the decision could play out. So in one scenario, in an ideal world, the court grants nationwide workplace protections for all LGBTQ Americans. So that's a positive ruling surrounding the 2 cases applying to sexual orientation and the 1 case applying to gender identity. It would be a watershed moment for fairness and equality, again affirming that simply being LGBTQ is not a grounds for any form of workplace discrimination in the United States. It would also reinforce the overarching truth that LGBTQ people are and should be protected from discrimination under federal law. A total loss would be the court striking down federal protections for LGBTQ workers, leaving people vulnerable to discrimination in 26 states, but I think that might be 25 based on what Ames said, so I need to fact check that, including North Carolina. A total loss would be an outrageous attack that exposes the vulnerability LGBTQ Americans have across the nation. LGBTQ Americans would be exposed to discrimination within their places of work, or even fired if the US Supreme Court strikes down existing federal workplace protections. Nearly half the states have non-discrimination laws. It is unlikely that a ruling will roll these laws back. There could be a mixed decision, which could include several different outcomes, and there's 3 cases at play. So this is where it could become a bit tricky. In addition to a clear win or loss, the court could deliver a ruling that is a loss for gender identity and a win for sexual orientation, or vice versa, or that is a narrow win or loss for either side. But at the end of the day, any ruling that allows discrimination based on gender identity but not sexual orientation, or vice versa, and or does not offer the same level of protections as it does for other protected classes would fall short. So what would a positive outcome mean for LGBTQ Americans? So even in the event of a historic ruling, this full win, right, against discrimination and for LGBTQ employees, that is still not the full scope of discrimination protections that our community needs, right? It would still be legal under federal law for stores and restaurants to discriminate against LGBTQ people, still be legal for trans people to be harassed in restrooms and gyms, can still be legal for federally funded programs, including hospitals, colleges, and adoption agencies, to discriminate against LGBTQ people. So even if we get that full win, it's still definitely not the full scope of protections that we're fighting for at the end of the day. In the event of a negative ruling, it would give companies a right to discriminate against LGBTQ employees under federal law, tell hardworking LGBTQ people that our nation's highest court believes they should be able to be fired from their job, lose their health care, and lose the ability to take care of their family just because of who they are. And it would also strip away existing federal employment protections for LGBTQ people. In addition, it would undermine our nation's non-discrimination laws and invite discrimination and harassment against LGBTQ people nationwide. And it would gut more than 2 decades worth of legal rulings that currently protect LGBTQ people from discrimination across the United States. So that's an overview in the broadest sense of the word. I'm gonna stop sharing real quick. And in preparation for all of this, we've identified a group of spokespeople that touch different parts of our community who will be available for comment for the media when decision day drops. It's everyone from Kendra to Bishop Tanya Rawls out of Sacred Souls Church and Freedom Center for Social Justice, to Vansana Nothlina, who runs Beta Manda and Huri Bravana in downtown Raleigh, and a few other folks. So we have, we're kind of trying to pull resources for the media in advance so everyone's as prepared as possible. And this webinar is an example of that. So we really appreciate you doing the work to make sure you're as informed as possible before the decision day actually drops. Ames, did I miss anything, or is there anything you want to add to what I just said?
Nope.
Okay. So I know we have a limited number of folks on the call. If we have any questions, we would love to hear them from you. So just wanted to create a little bit of space for that before we go back to Artie and maybe Kendra to wrap this up. Okay. Artie or Kendra?
Yeah, thank you so much for joining us. We know this was a quick training. We know that we're trying to get this information to you in a very busy time, and we want to make sure that you have the information you need. We have a question from someone in the chat, and it is, I would love to hear someone talk about some North Carolina specific things about the SCOTUS decision. So if anybody can speak to that, Ames, if you'd like to speak to that, Kendra, and also how does North Carolina compare on some of the metrics, for instance?
Do you want to take the metrics question first, and then I think we can go to the SCOTUS decision? Okay, go ahead.
It would be great if we knew the answer to that. We do not have data regarding the impact of COVID-19 on the LGBTQ community because no one is systematically collecting that data. There are some states who are, and I think that eventually we'll be able to make some projections about the impact of the pandemic on people everywhere in the United States who are LGBTQ, but until data collection changes, at a minimum, the census could count LGBTQ people. We would have a lot more data than we currently do. There's also not data that is comprehensively collected about health access or discrimination or unemployment among the LGBTQ community in North Carolina, although we have sent a survey to our membership asking how people are doing in the pandemic, where they have concerns and where we can help. And I think there are a number of other organizations that are doing the same thing. The Transgender Legal Defense and Education Fund has a survey that's out. So there will eventually, like I said, we'll be able to make some projections, but it's a hard road here in North Carolina until we get more data.
Yeah, I just want to speak to that. I saw, Joe, that you commented in the chat box. Yeah, the data issue is a major roadblock for a lot of our efforts, and it's, practically systematic erasure of our community, because even from a medical standpoint, if we had better tracking, we'd be better able to identify disease, who's most impacted, and create some pathways for more effective treatment, right? Or some studies that would focus on our community. And so it's something that actually impacts us on every level, not only in healthcare settings, but many states don't do any tracking around hate crimes. They're like almost in every particular system, we are an afterthought. And it's a big focal point of our advocacy for that reason, because without the data, we actually can't make some of the cases for discrimination. Everything ends up being qualitative rather than quantitative, which is what would be fundamental for us to be able to institute, effective policy change. And so unless we have a friend or an ally or someone who's connected to the community or someone who just is more fair-minded that puts these systems in place, we are systematically left out of these systems, undercounted, and thus underrepresented. So, and in terms of North Carolina and the SCOTUS decisions, obviously, that's one of the reasons that we have the spokespeople lined up to talk to about the reality inside of North Carolina, both folks who are directly impacted, but also folks who were engaged in part in the HB2 and HB 142 struggles in the state, so that they can speak specifically. Obviously, the decision would be huge, not just for North Carolina, but nationally, because it would finally, it would give us a final ruling on discrimination in the work and would effectively, solidify, if we're victorious, which, we have questions about that, solidify some of the bases for non-discrimination in the workplace that we don't have. And that would have been, of course, one of the protections that would have been given with some of the non-discrimination ordinances that have been passed locally that have been senselessly prohibited and revoked inside of the state. So I think it, on the one hand, it is like uniquely important to North Carolina given HB2 and HB 142. On the other hand, it is not, because it is a nationwide ruling that would infect the entire country. But we have folks lined up to speak to their specific realities and lives as North Carolinians whenever the ruling does come down. Ames, do you want to add anything for context around SCOTUS and North Carolina?
I would just add, it's important to also consider the context of how conservative the federal courts are in North Carolina. So it would be important for there to be controlling precedent, which there currently is not in the Fourth Circuit where we live, and many of the district court judges. They were conservative before Trump started making appointments, and now they're even more conservative. And in fact, the Senate is convening to try to confirm a bunch more conservative federal judges. Having said that, I think the state courts are seen as more progressive and a better place to bring some employment-related challenges. And the federal decision would not be controlling there, but it would certainly be strong and useful precedent. So it's going to be, it's going to be important however this turns out.
All right. Do you want to wrap us up, Kendra? I think that might be it for questions.
Yeah, so I mean, I know, Joe, we have a good relationship and you see us as a resource often. We would ask that if you have any colleagues that would benefit from this information or who might like to be connected to us and have the good relationship that we already have with you, that you would share the information or connect us, because our intent is really to make sure that you have all the tools and resources in the space to provide the best and the most accurate coverage on our community, and we want to be allies in that. Don't hesitate to reach out to us at any given point, or to pitch a story to us that we can help populate some of the speakers for you. And we appreciate your really fair and detailed and thoughtful coverage, always. And so we look forward to continuing to work with you. All righty. Any other lingering thoughts from folks before we hop off?
Yes,
right.
thank you so much for continuing to share this, and for joining. And for those of you who will see this in the future, please continue to see us as a resource. We want to make sure that all reporting is accurate and fair and has a holistic understanding of our community and everything that we are facing across situations. So thank you so much, and everyone have a great rest of your week. Thank you.
Thank you.
Bye, y'all. Thank you.
Bye.
Bye.